Corneal collagen cross-linking has been revolutionary for our practices and our patients. And that is because it is proven to prevent progression of the disease. You know, years ago when I wrote my master's thesis on keratoconus, this was in 1993, we didn't have this in our practices, at least in the United States. There wasn't much we could do other than fit contact lenses and hope they didn't progress to a transplant. Now we have evidence that this procedure actually prevents progression of the disease. It prevents steepening of the cornea. It prevents increase in myopia. It prevents poor VA with glasses. So if you can cross-link them early enough, they may just see well with glasses. They may not need contact lenses at all. And they prevent more difficulty fitting contact lenses, which is what we see when we see Ks in the 70 diopter, 80, 90, 100 diopter range. These are very tough corneas to fit. So if we can cross-link early and prevent all of this progression, it helps us as the contact lens fitters as well. So in order for CXL to occur, we need 3 essential reactants that need to be in place. So let's talk about the science. We need UV light, which is the energy source. We need oxygen, which is the rate limiting reagent. And we need riboflavin in the form of drops, which is the energy transfer. So the basics are that you put the drop, riboflavin, vitamin B2 drop, combine it with UV radiation for about 30 minutes. It produces oxygen radicals, and this induces collagen cross-links in between here, making the cornea stronger, making the cornea stiffer. So basically what I tell patients is this procedure stiffens the cornea so your cornea can't steepen up and progress over time. And here's a great depiction on the right. As you can see, the stiffened cornea right here versus the floppy cornea that was not treated with the UV light and the riboflavin. So what a difference here. It's 98 to 99% effective in most studies. There is so much research basically proving the efficacy of CXL. This is just one particular study, but I could quote so many studies. This particular study was out of Europe in 2014, and it was a 3-year study. So basically what we want to look at is long-term results. They've been doing this in Europe longer than they have in the US, so there's some very, very good data there. 100 eyes with progressive keratoconus were randomized into cross-linking or a control group. Cross-linking was performed by instilling riboflavin and dextran for before the procedure and then also during the 30 minutes of the ultraviolet A irradiation. Follow-up exams were performed. And the conclusion is that at 36 months, there was a sustained improvement in Kmax. Actually, the corneas became a little bit flatter, uncorrected visual acuity, and best corrected visual acuity after CXL. There was actually improvement in refractive power, whereas for the eyes in the control group, these categories worsened and the cornea demonstrated further progression of keratoconus. So again, excellent study, 36 months out, and this is very typical